You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to the first episode of Season 3 of the RN Mentor podcast. I have the great pleasure today to be speaking to Dr. Stephen Ferrara. He is a practicing nurse practitioner with over 20 years of clinical experience. He is Associate Dean of Clinical Affairs and Associate Professor at Columbia University's School of Nursing. Dr. Ferrara has held various elected leadership positions in his state's nurse practitioner organization and was appointed executive director of the NPA by its board of directors. He has been instrumental in championing a number of pieces of legislation in New York State to increase patient access to care. He is also the interim executive director of Jonas Nursing and Veterans Healthcare, editor-in-chief of the Journal of Doctoral Nursing Practice, and Region 2 Director for the American Association of Nurse Practitioners. Dr. Ferrara holds a passion for healthcare technology and integrating evidence-based practice into daily practice. He was awarded the American Association of Nurse Practitioners New York State Award for Clinical Excellence, inducted as a Fellow of the American Association of Nurse Practitioners, a Fellow of the New York Academy of Medicine, a Fellow of the National Academies of Practice, and a Fellow of the American Academy of Nursing. He is also the founder and moderator of NP Chat, a weekly Twitter chat for nurse practitioners, which I highly recommend. I will have the link for you on the website, so please make sure you give the chat and Dr. Ferrara follow. Welcome to the show, Dr. Ferrara.
Thank you so much for having me. It's my pleasure.
So fantastic to have you on the show. I have known you for not that long, maybe going about a year.
About a year.
About a year. So happy to have you here. Just like we do with all my previous guests. I want to get started with how you got started in the profession of nursing to where you are now. And from what I see, that's a lot of fellowships.
Yeah.
That's a lot of fellows. So you've done something right. So let's talk about how you got into the profession of nursing.
Apparently so. So I had been always wanting to be in the healthcare professions. I'll be very honest, I wasn't sure exactly what it is I wanted to be. And I kicked around all of the healthcare professions, from physician to pharmacist to physical therapist to all of these other sort of, very important roles in the healthcare system, but still not necessarily having, any direction. So I found myself in college as a biology major, again, under the assumption that I was going to do something in healthcare. And I will say I did not knock off in college. I was a good student, but I wasn't necessarily still convinced what I wanted to do. And I found myself graduating with this biology major with a chem minor and not really having any direction. And I give credit to my aunt. My aunt is a registered nurse and had always been whispering in my ear, or maybe screaming in my ear, go into nursing. And I didn't know the role of nursing. I really was unaware. So, I've graduated college at this point. I said, okay, I need to do something. I became a medical assistant. I became an emergency medical technician. And I said, I want to get involved in patient care in some aspect. And I want to learn more about the profession of nursing. And I did, and I loved it. And, the rest is history. I returned back to school, and I fortunately had all the science prerequisites. So I was able to do an accelerated baccalaureate program. And I knew I wanted to become a nurse practitioner. So I did work full time while I was going to NP school. I did med surg ortho for a year and a half while I worked every Friday, Saturday, and Sunday, 12-hour shifts while I was going to NP school. And I knew that I wanted to be in a position where I could help educate patients, and I could help make healthcare decisions with them. And that was really, really important to me. So that started my, sort of nurse practitioner career. And as I was an NP, I worked in various primary care settings. I had said to myself, I feel like I want to do more from a systemic level. I want to improve healthcare beyond the one-on-one patient provider relationship. And I found myself, going in areas of, administration and getting involved at a, administrative level. And, went back to school, got my DNP, and, yada, yada, yada. Here we are.
That's great. Now, you mentioned you went from your accelerated baccalaureate programs. Did you go straight into a nurse practitioner program? Like, did
I
you
did.
finish one and go straight into? Because I have students in at my university that have always asked, like, should I do a couple of years of experience and then go into
Right.
an NP program, or do you think I should go straight into an NP program? Can you talk a little bit about that? Maybe the pros and cons of doing something like that?
Sure. And it's very controversial. It's as much controversial today as it was back 21, 22 years ago when I did it. And, you know, I think it's not for everyone. And that's not to say that I am better than anyone else, but I think I think if you start out with a mindset of what you want to do, once you figure out what it is you want to do, it becomes easy. And I never minimize the role of a registered nurse, and I do believe I spent my time in the trenches, working as a registered nurse. But I knew that I wanted to be able to be an advanced practice nurse, and I was able to work through that. And I think there are advantages and disadvantages. I'd like to think, I'm talking about myself. I did have 3 years experience in the healthcare related professions, at a technical level, as an EMT, as a medical assistant. So I had at least some, I was familiar with terminology, with settings, and having been responding in emergency medical situations. So, I think, at the time I didn't know that, but I thought it was, ultimately great experience. And while, I am not comparing a nurse to a medical assistant or an emergency medical technician, the roles are different, but there's definitely overlap. And that exposure for me allowed me to transition, from the RN role to the student NP role, and then beyond. I think there continues to be controversy. And I will say I have, mixed thoughts on accelerated programs. And, I will say this: it is not for everyone. There are no shortcuts. There is no way to, sort of, do something quicker if you're not ready to do it. But I think it takes a lot of reflection on the student and figuring out what it is they want to be. And, again, I had already been, through college my first time. I'd like to think I was a little bit more mature at that point. So I had at least some worldly knowledge that I was able to apply in my studies as I was becoming an advanced practice nurse.
And that it's interesting you mention that because teaching some of the accelerated students myself, I find that they tend to draw on their previous college experience, right? They have their study habits down. They have sort of certain habits that actually help them through the process. They come in there with the understanding that they're going to be and it's not a regular load of coursework. It's
Right.
additional, right, than what
Yes.
normally in a generic program we'll see. We kind of front load them, back load them, every which way we kind of pile it on. And we hope that their previous experience, successful experience in college, has actually will help them be successful in the program. And I know there's programs out there that aren't as choosy who they bring in, but I think those
Right.
programs, you need to be choosy because you want the students to be successful based on how they've gotten to that point. So I think that there's definitely a component there where we need to be more selective as to
Yes.
who we need to be. Not, I don't want to say selective, more realistic as to the people who can complete the program and individuals who may benefit better from a longer program because you're not taking like 20 units a semester
Right.
or 20 plus units, however many units it is.
Right. Yeah. It was an interesting experience in my program. We were all sort of type A
Oh
personalities.
yeah, definitely.
We would go through that that first test, and I got 2 wrong, and look up in your textbook and trying to get those extra points. And I mean, it was a little bit much at the time, but we were all wanting to be successful, wanting to understand, and wanting to become nurses. That's what we wanted to do. And I agree fully. There's a lot of talk at the national level about standardization of programs and have meeting some sort of, I'm going to use the term, minimum requirements as to what you need to do in order to become an advanced practice nurse. And, there hasn't been consensus yet.
Right.
What I will say is, and I don't purport to know all the evidence and data, but there has not been, to my understanding, any concrete evidence that shows that, an accelerated nurse practitioner has, worse career trajectory or worse outcomes than their counterparts who went to the more traditional method. So,
Right.
I think the wonderful thing about nursing is that there's so many entry points. And I think the hard thing about nursing is that there's so many entry points. And,
Exactly.
it leads to a lot of variation and a lot of lack of standardization.
Right. And I'm not a nurse practitioner. I went a different route I got my my master's in nursing education. And I've always been sort of education, and I just followed that path. But I was whenever my students ask me, should I go straight from getting a bachelor's straight into a MP program, I always say, well, it depends, right? It depends on how much you want to do, because I always feel you go into an MP program, if you go straight out of a bachelor's program, you almost go in at a little bit of a disadvantage because you have your colleagues that may be in that class with you will have years of experience behind them.
Right.
And it just means you have to do more work, right?
Mm-hmm.
Some of the stuff that may be second nature to them is not second nature to you yet, and you just have to do that extra work. If you're
That's
willing
right.
to put in the time, I think we've had some incredible nurse practitioners come out of, at least that I know personally, that come out of the program, and they've been very successful. They're incredible nurse practitioners, but they
Right.
knew the work that they had to put in, right?
Right.
So,
Yeah,
so
100%.
yeah, to your point, yeah.
Yeah, this is not how can I become a nurse practitioner the fastest way possible. That is not the right mindset to go into this profession, because there is a lot that you must know. There's a lot of work that you need to do in order to become a competent and proficient nurse practitioner.
Yeah, I'm going to bring up a point where I've had my own discussions and viewpoints on this, and so looking at there's a lot of controversy out there as far as the scope of practice, right? From a nurse
Hmm.
practitioner perspective. So scope of practice, talking about, and there's definitely a number of physicians out there that are lobbying against nurse practitioners having
Hmm.
full and independent scope of practice.
Right.
And we know that evidence doesn't really support that, but that doesn't stop them from trying to not allow that to happen. So about half
Right.
the states in the U.S. right now have full scope or a version of full scope that they have allowed during the pandemic. We've
Hmm.
seen a lot of relaxation of things for nurse practitioners where they are more independent and are able to practice. So talking about that, what do you consider full scope, and how would you counter the argument that sort of physicians are making, saying you haven't had the same level of training, so you shouldn't have the same scope of practice? Where I don't see it as the same scope of practice as physicians, but they do, and that's the
Right.
argument that they move forward with. What is your sort of perspective on
Hmm.
nursing for nurse practitioner full scope of practice, and what physician scope? How do you differentiate the two? Because I know there's
Yeah,
overlap, obviously.
and there's overlap, and I think at the end of the day, it's knowing that nurse practitioners practice as nurse practitioners. We're not physicians. We don't want to be physicians. We want to practice advanced practice nursing, and physicians practice medicine. And at the very core, that's the difference. Is there overlap? 100% there's overlap. And are nurse practitioners being used where physicians used to be employed? Sure. But what the way it's supposed to be is that the physicians are supposed to be able to take on the higher acuity cases that requires that expertise of years and years of additional practice hours. That's not to say that nurse practitioners can't handle higher acuity patients. It's we have yet to harmonize the all the various professions outside of medicine. And we could talk about nurse practitioners and physician assistants and pharmacists and psychologists who can prescribe. And it should be a very multidisciplinary approach to healthcare. But at the end of the day, it still is, you know, one profession wanting to be the captain of the ship, right?
Right.
As far as the different states, this is what never made sense to me. You could go to school in, I'm going to use Vermont as a state. You could go to, Vermont, do your transition to practice hours, and you're a full practice authority nurse practitioner. You have a change in your family situation, and you say, "Oh, I need to move to Texas." Right? You move to Texas, which is known as a restricted practice state, and all of a sudden, everything that you could do in Vermont is different, and you need co-location of you and your collaborating or supervising physician, and you need all of these other hoops that you need to jump through, and nothing changed. You are still the same person. You are still the same person with the same knowledge that you had when you were practicing in the Northeast, and now all of a sudden you have to do something different, and that's what really doesn't make sense. And I think at the end of the day, scope of practice, and I dislike the term scope of practice. It automatically sets off like, oh, you're trying to expand your scope of practice. You're trying to do something you weren't educated and trained to do. I don't want to do anything outside my scope of practice. I want to practice at the terminology is at the full breadth of my license. I want to be able to do everything that I've been educated and trained to do in a setting that, I have a license and a national board certification that shows that I'm competent to do so. And that's what really doesn't make a lot of sense to me. So, each state has to have that discussion. The states who are not full practice authority, and they have to have their own, bills go through their respective state legislatures, and that's where we're at. So it's really hard because you can have a very state that nurse practitioners can and here's the other thing that I will say. This is not about nurse practitioners opening up their own practices, right? And competing per se against another profession. Because Lord knows, owning a practice is not easy. You could see how the traditional practice has largely gone away and been absorbed by these large hospital systems. And whether that's right or wrong, that could be a whole nother discussion. But this is not about opening up your own practice. This is about being able to do a job for the patients that I see and not make it harder for that patient to get care from me, or take exponentially longer to get an approval of something that's fully within my training and education of, signing off on a physical. And there are some forms, some federal forms that, it is a physical. It is an annual physical exam, and you can't do that as a nurse practitioner. So I think, we have a long way to go. I am not saying that nurse practitioners are the solution to medicine's shortfall and shortcoming. Absolutely not. It's because of the physicians who work with us in the trenches that say, yeah, you need to do what you need to do so I can do what I need to do. And, this perception that there's oversight of nurse practitioner and physician practice, there's collaboration. And, it's been said, nurse practitioners don't know what they don't know. And, I reject that. And, are there some people who have that mindset? Of course. Are there others in other professions that have that mindset? Of course, too. So, I hate to be at the battlefield, because healthcare is hard enough. And if we're battling with each other, we can't advocate for our patients. And that's how I've approached it. And that's how I really try and resolve a lot of these differences and issues today.
And that's one thing I guess I sometimes have difficulty understanding is when physicians approach this with the perspective that I need to supervise you, as opposed to a collaborative relationship where your colleagues working for the betterment of the patient outcome, right?
Right.
So I think that's where I've always I never understood that need that I need to be in charge and that component, and I don't understand that, and that's usually where my feathers get ruffled, even though I'm not a nurse practitioner, and it doesn't
Understood.
affect me. But it's good. But thank you for your explanation, and
Sure.
it's really good to have your perspective on this because you're on the grounds and you're practicing. So it's good to have that perspective.
Sure.
One of my guests over the summer. She's from Canada, and they get certain prescription authorities in Canada at a bachelor's level. So it's just a matter of, are you educated for what you're doing? And if the answer
Right.
is yes, you should be able to practice it. That's my view on it. So regardless
Absolutely.
of,
And there are plenty of regulatory bodies that oversee the professions that if you are not safe, then you shouldn't be doing what it is you're doing, and
right.
that goes for anyone. There are processes, and of course we don't want patients to get harmed in the process, but to have this perception that, this one profession is not safe because they don't know X, Y, or Z, that's just, I think it's a lot of
Yeah.
propaganda, if you ask me.
Yeah, and I know, even though there's organizations that I know of that try to incorporate nurse practitioners in the clinic
Hmm.
sites that they have. I also know physicians from those organizations that lobby against it, right?
Hmm.
So,
Hmm.
and that's I never understood, and I've never gotten a straight answer from people other than what we already discussed.
Right.
Um,
Sure.
so. So it's just a matter of I think knowing and looking at nurse practitioners, for example, they serve more underserved uh, communities. I mean that's sort of a
Hmm.
given that they do that, and they fill a need that
Hmm.
physicians are not filling. So I think that it's important to have that perspective that if you do take that away, or if something does happen where that scope of practice goes away, there's a we're creating an access issue for a lot of individuals.
That's right. That's right. And there has been talk saying, oh, nurse practitioners end up practicing in the same areas of physicians, and there is data. There's Medicare data that shows otherwise, and the states that have a mileage limit as to where the nurse practitioner can practice away from their supervisor or collaborating physician has an impact on those rural and underserved areas. So it's such a complicated scenario that it's there, and so many variables that again, at the end of the day, I am looking to work together, do the job it is that I've been educated and prepared to do. And I would hope everybody else in the healthcare system is doing that as well.
Yeah, yeah, definitely. And for the record, there are a lot of physicians that do support this. So
Absolutely.
it's not
Absolutely.
just some of them are louder than others. So I think that's why we hear
For sure.
some more than others. But I know a lot
For
of
sure.
physicians that support it and like you said, the ones that work with you know
Yeah.
what you can do and are perfectly okay with it, with the practice. So thank you. I do want to talk to you a little bit about. Sort of your career path,
Hmm.
how you came, like I mentioned in the beginning, you're a fellow of a lot of different things.
Hmm.
How do you get your career? How did you get to the point where because those are all recognitions for achievements. They're
Right.
not handed out because you have memberships to an organization or anything like that.
Right.
They are recognition of achievements and success within your professional practice. What led you to be where you are, where you have? Because if I didn't read off all the dates, but the dates for your fellowships go back for about 10 years. And every
Hmm.
year
Hmm.
or so, you tacked another one on. How
Right.
do you get to the point where you are being recognized by colleagues for
Right.
having excellence in your practice? How did you
Right.
get there? Were there people involved? Was it a solo journey? What was it?
Definitely not solo. And I do believe it was a village of supporters and mentors that really lifted me up and, tried to make sure that the work that I was doing was recognized. And, I would be lying if I said to you, I knew what I wanted to be, even when I became a nurse practitioner, to be in the seats and the hats that I'm wearing. I can't honestly say that it was planned out by me, but I followed my passions and I followed the areas that I would spend inordinate amount of times on. That was beyond my workday, right? So I became very involved with the legislative process, and found myself, you know, reading up on the legislative process and meeting with legislators and doing all of these other initiatives that it became from that I was just very dedicated to, that goes beyond your regular quote unquote 9 to 5 job. And it was for that I became really involved in the Nurse Practitioner Association New York State, which is the statewide association for NPs. And I sort of look around and say, why isn't every nurse practitioner in the state a member of this wonderful organization? Why isn't every nurse a member of their respective specialty organization? And I will say this: not all organizations deserve to have membership because they may not have been so responsive to the needs of the members in the past. And I think now we see this more than ever. But you need to be somewhere, right? And I do believe in the power and the strength in numbers. So if you're able to find, like-minded individuals, a coalition of individuals that have this, idea of where we should collectively be, I think that's where you want to be. And I think you're able to get a lot more done that way than you are on an individual basis. So that really fueled my passion for, health policy, which again is not something that I knew back in 2001 when I graduated as a family nurse practitioner, that's where I wanted to be. But it just became something that I was really drawn to. And being able to say, or at least say that you had a little bit of a part in changing either a state law or a federal law, I think that's pretty powerful. I do this because I want my profession to be better than it was when I started, right? Like I want to improve upon the current environment. And there's a lot of work to do. We know this. There's a lot of work to do in many different areas. But, that's what fuels me. That's why I do what I do.
Yeah. You mentioned mentors along the way. How did you stumble on them? Because again, one of the reasons I started this podcast, I was just not talking to the right people, right? Like even if the people I wanted to talk to weren't around me, right?
Right.
So this became a good forum for me to talk to people I wanted to talk to and learn from, but also share their experience with everybody else. So how do you like did you happen to be in a position where they had the office next to you and they just took you under their wing, or was that a proactive approach on your part to seek those individuals out where they could help improve, not improve, that's not the right word, to help elevate your platform?
Right. I would say in the beginning, it was more of what they saw in me versus me knowing that I needed to look for mentors. So I had the extreme benefit of having, some people reach out to me and said, I appreciated your perspective on and your willingness to speak up on this issue. And it encourages you and it gives you sort of that permission to do it again and to go forward with your convictions. That was really earlier in my career. Now, I think it's amazing to be able to, seek out people who or know of, and they respond to you. And I find myself in a position now where people reach out to me, and I'm, honored and flattered to do that. The challenge is the time balance, and I wouldn't want to work with someone if I can't give them the time that I believe I need to give to them in order to be successful. So that's kind of where I struggle with that today. But yeah, they definitely saw something in me, and I'm grateful for them. And they were able to sort of drag me, if you will, to the next level.
It makes sense. Sometimes we have to be dragged into things we may not actually know we want to be in, right?
Yeah, I mean, I wanted to, again, back in the day, I wanted to see my patients and not get involved with everything else. Like, oh, I'm happy, I have my family, and I don't need any of that stuff. Well, here we are, and I wear many hats now, and I'm kind of going all day long, but I don't consider it work. It's really great things that I'm able to be involved with today.
You mentioned family. You are doing all this, and you have a family. So
Yeah.
how does that work? How does
I have an extraordinarily supportive wife. who is also a nurse practitioner. We met in NP school. We had very similar sort of paths in that she was a bio major we met in the sort of in the nursing program. So I can't say enough how supportive she has been, and taking care of the kids when on the weekends I was writing a DNP paper and having to do work or a conference call or a board meeting. So I certainly owe it all to my spouse, to my wife, and my kids are great. I mean, for the most part, they're three kids. And, they're three kids, and but it's all been good. I do struggle, I'll be very honest, in finding that balance and being able to unplug. Somebody was telling me, oh, I'm just going to unplug today, and I'm like, I don't think I've ever done that. And that's on me, right? Like, that's my fault. And of course I go on vacation, of course, but I do, because it's my fear of what am I going to return to? How many messages am I going to be going through when I get back? So, my mindset has been, well, if I can kind of, triage and do some of the urgent ones and take care of this now, and I won't have to deal with it later. I'm sure that's not a good method, but I haven't found anything else that works for me yet.
Yeah.
I'll still consider myself a work in progress.
I actually just did that, not necessarily unplug, but not check work email for about a week and a half,
Yeah.
and it drove me absolutely bonkers not to check, because I didn't. It was actually it was causing, I think, more anxiety
Yeah. Right.
for me
Right.
than if I had just checked it. But I was trying to be more disciplined with not checking work email constantly. I mean,
Right.
it's a little bit crazy that that exists in my head, but it does exist in
Right.
my head. I didn't come back to anything too bad, but yeah, but the
Well, that's
anxiety
good.
it was causing me was just ridiculous. I
Yeah.
definitely
Yeah.
work on that. That's not normal.
Yeah. That's not normal. And I'm sure there is something, that we should be doing to work on that. But, I was going to take off, quote unquote, off, the week after Christmas and between Christmas and New Year's. And then, at work at Columbia University, that's when COVID vaccine started to become available. And now I'm on calls and trying to make sure that my staff gets COVID vaccine in the primary care practice. I'm trying to make sure that the students have access to, so it became this, oh, I'm going to lay low this week, to I was on calls all day long. I mean, and this is our challenge with the COVID vaccine today, is that there's, the guidance is changing literally by the hour. And availability is an issue, and which vaccine, so there are just so many things that, again, I like to think I'm helping out in a way, and making others safer in the work that I'm doing. But I am looking forward to someday soon to totally unplug.
Wishful thinking, right? Wishful thinking.
Yeah, yeah,
Um,
I could try.
now you mentioned the COVID vaccine. I want to, and I know you started to do somewhat of a chat with some social media nurses with the COVID vaccine. What do you think, in your opinion? What do you think we need to do from a nursing perspective to really get the word out to the communities? And I think I think one of the biggest barriers for me is right now is I can't even find where I can get it. Right.
Right,
I
right.
I'm not bedside, so I definitely don't want to go to the front of the line and say, "Oh, I'm a nurse," and give it to me, because I'm not bedside. I don't have that risk.
Right,
But I am in another. I think I'm next in line right now. But
right.
there's no way for me to know when and who's giving it and how it's getting distributed, other than the fact that the process, I think, on a national level, this got rolled out. It was a little bit screwy. Uh,
Yeah.
how do you think nursing can really step in from where we are and play a vital role other than giving the shot?
Yeah, I think it needs to be a coordinated effort on the part of nursing, and that's what I attempted to try and start. Just on social media, I'm a big Twitter user, so I, tried to leverage my Twitter network, and we had a few conference calls that we were on, and I realized really early on that we're early. Vaccines not available yet, really broadly, but we still need to understand, and now's the time when we really need to do the work to communicate and be transparent in what we know about the vaccine and reach our communities, because this is what's always uh, made me sort of like there's this idea that nurses are the most trusted profession, right? The Gallup poll is the poll that does this every year, and for 19 years in a row, nurses have been rated the most trusted profession out of all the professions. And the only year that it wasn't was 2001 after 9/11, when it was firefighters, right? So we have this history of being the most trusted profession, but we're also the most invisible profession, if you ask me. Now you could turn on, any media, and there's nurses, giving interviews from the break room, from their cars. And are we doing justice to the profession? If that's the only view of nursing, I don't think so. I think we need to have nurses on prominent appearances that are talking about vaccine, that are talking to their communities that they live and work, so they could allay fears, that they could try and do their best to educate about where we are, the vaccine, and try and get over this horrific time in public health. And that's what needs to happen. And, I don't know who the person or who the organization is to take that by the horns and lead with it. But, and there's been collaboration amongst health systems, and they're doing it, but it's not, in my opinion, broad or effective enough. And that's where I think we need to be.
And I agree. It does feel a bit clumsy, just because like you mentioned, for me, it feels like we don't know who's in charge, right?
Right.
Like the federal government passed on to the state. This state put out something. In my head, I'm like, we've been at this for almost a year. The fact that we don't have a detailed
Mm-hmm.
plan as to how this was going to roll out when the time came. How do we
Mm-hmm.
not have a detailed plan? And it's very general, where
Yeah.
everybody's kind of making stuff up. Sometimes it feels like people are just making stuff up as they're going along. And like with the numbers of vaccines available and who's getting it and how it's going to be
Right.
distributed. Like somebody had mentioned, like the vaccine vials have 6 doses in them, but they're only getting 5 syringes.
Right.
I'm like, well, take another syringe and get the other dose out. Why are you throwing
Right.
out a dose? What,
Right.
like the federal syringes don't look any different than the regular syringes.
No, they're no different. A milliliter is a milliliter,
Milliliters
at
and
least
milliliters.
last time I checked, right?
Right? So I'm like, why are you throwing out doses over the fact that the federal government didn't give you a 6th syringe? That
Right.
makes like stuff like that I'm like just a little bit confused by. Um,
Yeah.
but yeah, I agree. And you touched on something else that's been nagging me also, is why are we seeing? Yes, it's important for us to see nurses at the bedside, because we know they are struggling. We know it's been hard on the bedside nurses. We know it's been not just hard, it's extremely difficult. It's wearing them down
Mhm.
from every aspect you can imagine. But why are we not seeing them in something other than bedside? And
Right.
that's been, and we've seen it a few times, but I think there's definitely room for us to see them more out of that. Why are we not having nurse practitioners doing some of those? Talking to the communities, as you mentioned, because they are
Right.
providing care in those communities. Why are we not seeing, people that are doing some of the policy works and things like that. Why are we not seeing them? So
Yeah,
that's a great point.
and that's that has been my number one sort of driver for nursing, is that you can be in any setting or in anywhere and work as a nurse or as a nurse practitioner. And it may sound somewhat counterintuitive, to the non nurse who sort of is looking at this from afar, that I never wanted to work in a hospital. Like, I did my, I like to say I did my time in the hospital, but it is not the environment that I found most conducive to my style. So, the beauty is, there are just so many areas and aspects of nursing that you can find yourself in. And I think the ones that you can't find yourself in, you can make. And you can make that role make sense, because healthcare affects us, everyone, everywhere, anytime. So I think, above and beyond, that's really what nursing is about.
Yeah, that's an excellent point.
Mhm.
Um, Thank you. This has been great. Now, from a perspective of you do work with other organizations. How did you, other than your desire to work and improve the profession, how did you find yourself going that avenue and in these some of these cases actually leading the work?
Mhm.
How did you find yourself doing that? And
Yeah, I'm going to blame my mentors on that too. It was sort of something that I didn't know I wanted to be part of at the time, and maybe I was a little resistant in the beginning. But as I became more familiar, I started out as like the membership chairperson of the statewide association, and ran for treasurer, got really involved and understood, not-for-profit organizations, which are, there's so many nonprofits across the United States, and just got to see board governance and what a board is supposed to do and what a board member is supposed to do. And you're not supposed to be, out there in the nitty-gritty and micromanaging the work that needs to be done, but you're setting direction. And that's where I think it intersects with policy and, my desire to improve health policy. I guess I was so involved with that I did become interested in the day-to-day operations, and that led me to be fortunate to have an opportunity to apply as executive director of the statewide association for nurse practitioners in New York State, and I've been doing that since 2012. And then, most recently, Jonas Nursing and Veterans Healthcare, which is a not-for-profit that funds Jonas scholars who are nurses going for their doctoral degrees. That I've had the organizational experience to sort of, in an interim role, be able to assume that position and really hit the ground running. I do think organizations, they're different, but the work you do is pretty much the same. Raise money, try to fulfill the direction of your board, and that's kind of what I do. So fortunate again. If I'd be lying if I said that I mapped out all of these moves. Some of them happened to come to me. Some of them I pursued. But I think it's having the awareness and being open to taking on new experiences, and I've been not one to shy away from that, almost to my detriment, right? I'm learning to say no to certain things, and things that are not necessarily in my wheelhouse, or things that I am not as passionate about. So I've been again very, very lucky to have been in the positions I've been, and I would advocate for anyone to keep an open mind, and you don't know where it may take you.
you touched on something I myself recently sort of came to the realization is learning to say no to things you're not
Mhm.
passionate about, because it sort of kills everything when
Yeah.
you're involved in a project where you have no desire to be in
Right.
it. Some work we have to do. It's part of our job description, and we have to do it. But there's other stuff that you don't necessarily have to be the lead on or even participate in, where people will ask you because they know you're the go-to person if they want to get stuff done. Sometimes, right?
Right. And it
So
makes me feel bad. It
yeah,
makes you feel bad when they say no.
it does. It does. So
Makes me
yes,
feel bad.
learning how to say to no to some of those, I think it's good
Yes.
for not only the project or activity, whatever it is, but also
Right.
for you that you're not overwhelmed yourself. So that's a great point, and something I struggle with that also. By the way, I
Yeah.
struggle with
Yeah.
that also.
We are works in progress. And I
Yes.
think, we need to just try and be better the next day.
Very true. Very true. I want to be cognizant of your time. Thank you so much. I'm going to give you a few minutes if you want to. If there's anything else you want to chime in on or talk about that we didn't cover.
I think we covered a lot of topics, and I do appreciate the opportunity. I do want to help people. I do want to help nurses and those trying to advance their career. So I'm reachable on social media and in various platforms. And if there's something I can do, I want to be able to help and maybe at least point people in the right direction or make a connection with someone else. So Ali, I appreciate the time and you choosing to interview me for your great podcast. And yeah, I certainly look forward to continuing our work together in our various circles. And it's been very good.
Great. Thank you so much. And I appreciate you sharing your time with us. And I learned a lot. I was, like I said, one of the reasons I do the podcast is because so I get to talk to the people I want to talk to.
Right. Right.
So it's always beneficial for me. I don't know if it's the other way around. Uh, so
No, this is great. I appreciate
so
it.
I appreciate the opportunity to talk to you. I appreciate the opportunity to help show your work and your career path. I know it's valuable for a lot of people that listen to the podcast, and everybody seems to take away a little bit of something from each podcast. So I appreciate that, and that's why we do what we do, right?
Absolutely.
Thank you so
Absolutely.
much. You have been listening to the RN Mentor podcast. Thank you so much for tuning in again to our first episode of season 3. Thank you very much and have a great rest of your week. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.